Last year, NHSX provided funding and support for a series of technology projects through its Innovation Collaborative programme. Across Greater Manchester, a new app called Safe Steps is now helping GPs and care homes to safely monitor and support residents with COVID-19 symptoms. This is their story.
We're in Auden House today, which is in Tameside in Greater Manchester. The care home that we're here today has been participating in the Safe Steps COVID-19 tracker for the past year. Care homes at the start of the pandemic were right at the front line of an unknown entity, and they were front and centre of a lot of requests for data and information and monitoring.
We were already working with care homes on Falls app, which we were trying to implement over the previous 12 months, and that was proving really successful in trying to get care homes to start to become more digital, provide us information. We then hit the pandemic obviously in March last year, and when that happened we thought, how can we repurpose the app so that it actually helped care homes provide us information around COVID. The main thing was that we were collecting data at a mass scale very quickly on residents about how they were on a day-to-day basis, and we were reactive to that.
So the COVID tracker really allowed the carers that work with them on a day-in, day-out basis and know those residents intimately to monitor and keep an eye on their health status.
It's all computerised, so we know any of the new symptoms that they're getting, any that they've had and how long the symptoms last for. It only takes about 5 minutes at the end of the day to fill it in, where it's taking us an hour, sometimes 2 hours on the phone. So if we're with that resident, we would log all the details while we sat next to the resident, and we ask them how they feel and what they would like as well, and then we'd input all that onto the COVID tab.
The biggest challenge that we found in this programme was just the sheer enormity of things that were being asked of care homes during the pandemic. And sometimes it felt like we were just another entity coming along asking them to do something new. We really started to pull out what would they find beneficial in this tool and worked with them in a way that felt comfortable rather than pushing it.
Anyone can use it. It's simple but effective. Well, it proves that all care staff and residents are like a family. It makes us feel more confident as well that we have other people helping us out. It's more safe, more secure.
We have controlled outbreaks, we have been able to track residents who have had COVID, provide the best care and also provide advanced care planning for those patients. It's not a replacement for people, but it enables a workforce to actually work smarter, work quicker, using that kind of digital technology to move things forward at a much quicker pace than we would have done.
Be part of the journey. Join the Innovation Collaborative Workspace on Future NHS. #NHSX InnovCollab.